Talkopolis, the social media TV network for your city.
Hi, thanks for joining us today on the Nashville Fitness and Beauty Roundup. I'm Zane, and today we're joined by Tracey Robinson of Trace Skincare Green Hills. So check back and enjoy the show. Tracey, thanks for joining us today. So tell us a little bit about it's a med spa? Trace Skincare is a med spa?
Yes. Yeah.
How would you define it?
A medical spa.
Medical spa. Okay.
I'm an advanced nurse practitioner.
Okay.
And I own and run the practice. I do have a medical director, Dr. William H. Edwards, Jr.
Okay.
So he is a board certified vascular surgeon that I've worked with for a long time. And
so he oversees?
He oversees, he is trained on all of my devices and procedures, does site visits monthly to review and check off on treatment protocols, prescription formularies, and then he logs on to my electronic medical recording system, and he has to sign off on at least 20% of my charts a month.
Oh, wow. So you really have a lot of oversight from a doctor.
Yes.
But as a nurse practitioner, you are doing the procedures.
I am doing the procedures.
Okay. So it's not just you're not just overseeing procedures and there's some other person there who's just you've trained personally or something. It's you. You're an advanced
It's all me.
Okay.
And if I'm interested in a new device, I call Dr. Edwards and we talk about it and look into it and we get trained together.
Oh, well. So it's a real partnership there.
Yes.
That's great.
Yeah.
That's great. Okay. Well, I haven't spent a lot of time in a medical spa, to be honest with you. So if you could just kind of tell me, if you were telling me about how you approach your clients.
Sure.
What would you do if I were to, let's say a woman walks in, or I'm sure men come in there too, but most likely you're going to have, I think that's primarily women coming in looking for what? What are they looking for usually? Well,
there's a range. It could be something as simple as, hey, I don't want any treatments. I just want to know about skincare and the best sunscreen. Or it can be, hey, I'm thinking about a facelift. What are my options? If I decide not to do surgery, what can you do for me? So I think we'll maybe talk about my services later, but that's kind of the range of
So you feel what they're looking for, what their goals are, what their needs are. Okay.
So I kind of pride myself, I think, as a nurse practitioner. I really look at the whole person and try to get an idea of, I get a medical history. I want to know what they're currently doing with their skin morning and night. And then finances is a big part of this.
Sure.
And so we don't accept insurance, and so understanding a man or a woman's budget is very important.
Right.
So I'll recommend everything from A to Z, but
so you work with them on what they can actually realistically plan to do.
Right.
Okay. But I'm sure a lot has to do with also. You mentioned they were thinking about a facelift. What are my options? So you offer options as opposed to surgery, to work with surgery?
Yes
both?
And no.
Okay.
Sometimes clients come and see me and I prepare them for surgery. So we get them on a really good skincare regimen so that they'll heal nicely.
Oh.
And sometimes women or men want to know just what their options are, and they'll kind of come in and start pulling or yanking, and and I can have an idea. There's nothing that I do not replace surgery and a scalpel, and there are many devices out there that do.
Sure.
So I really have to kind of gauge the client's expectations and go over well, what is the surgical procedure cost versus a series of my treatments. And a lot of times patients are pleasantly surprised and happy with just kind of cleaning up some sun damage or getting rid of some broken capillaries, and they feel like they don't have to wear as much makeup, and maybe that was distracting them just as much as a little bit of jowling,
Okay.
you know, and they can hold off.
Okay.
Yeah.
Imagine some are a little nervous about something invasive like plastic surgery, and they would probably
Right.
also be looking for something that's just affects the surface of their skin, or maybe it's just the certain levels of their skin through a treatment rather than a scalpel. They might
Right.
be nervous about a
Right.
scalpel, but
Yeah, it's the face is and the neck area, you know, three-dimensional, and so there's everything from neurotoxins that we use to help relax muscles. We have wonderful temporary hyaluronic acid fillers that help with loss of volume.
okay.
And we're just able to do a lot with those things. And then there's just the canvas, because
Sure.
some women come in and say, no needles. What would you do with me? I don't want any needles. And that's fine. You know, we've got chemical peels, laser resurfacing,
Sure.
microneedling, just a ton of options.
To just affect the
Right.
skin. And that is the biggest organ in the body, right? The
Yes,
skin.
it
So you have
is.
to learn
Yes,
how
it
to
is.
take care of it. Okay.
Yeah.
Well, we will get more into your specific treatments.
Sure.
We're going to take a quick break, so come back and hear a little bit more about exactly how Tracey can help you. Thanks.